Bandido.
The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗏𝗏𝗶𝗏 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗶𝗏. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗶𝗏 on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗶𝗏, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗶𝗏 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗶𝗏. Hi, doctor. Okay, so everybody, you're watching Healthline with 𝗏𝗏𝗶𝗏. I'm your host, Nicole Jacinto. We're here with Dr. 𝗏𝗏𝗶𝗏. How are you today, doctor?
I'm okay. And how are you, Nicole? Good afternoon. And good afternoon, everyone's our audience for today. I hope they're all.
You hope they're all
Yeah.
well. Yeah. I know your doctor and I were just chatting right before the show, and she noticed I had a bit of the sniffles. I don't know if it's an allergy, doc, or maybe the change of weather. Well, you know how the weather
Change of weather.
change of weather, yes, can trigger some sniffling or coughing, but it could be other things too. So don't forget to get checked out by your doctor properly. Anyway, folks, today we're here with Dr. 𝗏𝗏𝗶𝗏. She's an endocrinology specialist or an endocrinologist who practices in Makati Medical Center, of course. And today we're going to talk about diabetes, especially the myths about diabetes, if doctor would like to dispel any myths. And she's just here to give us some general information about it, because doctor, you were saying that July is Diabetes Awareness Month.
Yes. Fortunately, thank you for inviting me in this show. And this is a very good timing. This month or this July, we are celebrating our Diabetes Awareness Week. So this was conceptualized or approved or was made into law by President Ramos that we have to celebrate Diabetes Awareness Week every last third or to fourth week of the month of July.
Yeah, that's good because when I believe when we have things for awareness of medical issues and health issues, and it had to be made into law pa, no? It's especially it strikes our population quite a lot, I think. Maybe I can ask you that later, in a bit, like if diabetes is something that Filipinos that strikes Filipinos a lot. But before we go there, doctor, can you tell us, maybe just give us a quick overview of what diabetes is and the differences perhaps between type 1 and type 2 diabetes?
Yes. So diabetes mellitus is a came from a Greek and Latin word meaning sugar from your urine. So before the Greek olden times, no, you know that you have diabetes when you urinate frequently and there's in your urine, so it's like flushing all the waters in your body into your urine and the ants are crawling there. That's the olden times. We can say that you have diabetes. So this is due to a very high glucose in your body that is due because of your pancreas not working well. So our pancreas releases insulin that can capture all the sugars that we ate from our sodas, from our cakes, our rice, our meal, and then put it into our muscle to be your energy. So after you eat, like Superman, energized, and you can parang revved up, you are energized and you can work well. But that is if your pancreas are working well. But if it's not, you feel tired. The opposite, you feel tired, you have blurry vision, you urinate, you lost weight. Those are the things that describes typically of diabetes. But some you experiences this, but most of people that I see or the patients that I see, they don't have any symptoms at all. So the
Okay.
symptoms told you are due to a very high sugar wherein uh, your sugars are around 300 to 400 and they are losing that much weight. It means that it is destroying your body already.
Doctor, what's a normal blood sugar rate or blood sugar measurement
So
process?
fasting, meaning 8 hours of not eating overnight, should be less than 100 or less than 99.
Mm-hmm.
So more than or equal to 126, you
Mm-hmm.
are categorized as having a person having diabetes.
And
And if your fasting blood sugar is between 100 to 125,
Mhm.
parang you are categorized as having pre-diabetes. So it's a warning sign already that you might have it.
Mhm.
And when you have diabetes, it means that your pancreas is not really working well and you might develop some complications. And even when you have pre-diabetes, you can have complications such as blindness, kidney problems, hypertension,
Mhm.
and food complications.
Okay. And doctor, what is the lowest that your blood sugar should be? So if it's 126 and above, that's already if you fast for 8 hours and you take it. And from 100 to 125,
One
you may have it. Could be pre-diabetes. Okay. Now, what's the lowest that should be at any given moment?
should be less than 99 if
Mhm.
I'm going strict. But there are different categories wherein you can diagnose somebody to have diabetes. One, if you're random or any time of the day, check your sugar more than 200.
Ah.
And there are signs and symptoms that I
Mhm.
discussed earlier. Then
Yes.
any one of these, you can have diabetes.
All right. So, what's the difference between type 1 and type 2 diabetes, doctor? Is diabetes mellitus type 2 or is it do you call both
Yeah.
diabetes mellitus?
Different types of diabetes. One is type 1, type 2, and gestational diabetes. And there are different subtypes.
Ah, okay.
But for our patient or our listeners, I can deal with type 1.
Mhm.
Type 1 is a person whose pancreas is not producing a lot of, or not producing, or minimally producing insulin.
Insulin, yeah.
So these are the types of person that they should have insulin injectable
Mhm.
for life. So
Okay.
you can see them, younger patients, older patients
Mhm.
that cannot be controlled by tablet. It needs to be insulin as their main treatment for their diabetes. For type 2 diabetes, these are categorized as before sugar impairment for those who are adults.
Mhm.
But recently now, due to our lifestyle,
Yeah.
we can see younger patients, younger people who have diabetes. And this can be treated with medications
Mhm.
or not combination with insulin or other medications that
Okay.
is injected.
Mhm. And when you say gestational diabetes, doctor, does it mean those who are pregnant? And sometimes women will get diabetes when they're pregnant.
Yes. So gestational diabetes is an intolerance from glucose during pregnancy, diabetes during pregnancy.
If you get,
So yeah,
sorry, if you get
we
gestation,
also,
go ahead.
sorry,
Sorry.
no, we have a term called pregestational diabetes, meaning younger ladies or younger ladies who are pregnant to have diabetes already before they have their conception.
Okay.
So getting pregnant, they already have diabetes.
Okay. So, doctor, when is it true that of course you get diabetes from eating too much sugar? But does that just apply to diabetes type 2, or when it's diabetes type 1, it's really like your pancreas not producing enough insulin to lower the sugar, like no matter what you do, what you eat, even if you do not I mean, that would be hard to find something that doesn't turn into sugar at all. And as you said earlier, you eat things, even fruit has some sugar in it, no? Fructose, there's sucralose, there's all kinds of lows. And then, yeah, I'll let you comment on that.
Okay. For type 1 diabetes, it's commonly called autoimmune. So meaning there is something that is destroying your pancreas, like a certain antibody or a bug that can destroy your pancreas and make your pancreas non-functioning anymore. So this really starts with a little elevation in your blood sugar, but as the bug or the antibody destroys wholly your pancreas, we can see that there's elevation in your blood sugar. And if you are on diet, you really need some insulin to control your sugar. As with type, this is what we call lifestyle. So we can see that younger people or older people and our community or our environment, no, with the food that is shown in our social media, so they are high in calorie, high fat, high in sugar. It can make our pancreas work more hard and then get tired, just like an automobile who runs 5 times the normal. Then after a few years, tired, and it's not going to work as normal as they should. So that's where the difference between type 1 and type 2. Of course, with type 2, with lifestyle, sedentary, we have sedentary lifestyle due to our work.
Yes.
And also the food we eat. And so our weight becomes heavier. And then that's also one thing that can cause type 2 diabetes.
All right. Doctor, thank you for explaining that. We just have to take a very short break and we'll be back. And when we get back, doctor, I'm going to ask you to focus on the food and our lifestyle that you've mentioned a few times already, because I think that's something that maybe we should really focus on also during this particular show, so that we can stay more informed. And it's a reminder also to people when we talk about certain topics more than once a year, or we don't just do one thing once now, because there may be updates, there may be it's a reminder for all of us, whether or not you have the diabetes, to take care of yourself, to to take better care of yourself. So folks, we'll be right back. Stay tuned.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Jacinto and welcome to Makati Med Wellness Center. Located at Ayala North Exchange, the Makati Med Wellness Center is a warm and comfortable state-of-the-art lifestyle center where executive checkups and services that address holistic patient care and wellness can be done. We have a skin and laser hub, diagnostic imaging, health screening, mind and wellness care, and physical medicine and rehabilitation. The Wellness Center is equipped with modern facilities and staffed with competent healthcare professionals who are committed to deliver premium, personalized, and easy access healthcare services for both adult and pediatric patients alike. This is a great place to prioritize your health and well-being without having to be at the hospital setting. We are open from Monday to Saturday at 7 a.m. to 5 p.m. at the 7th floor of Ayala North Exchange Tower 1 in Makati City. It is also accessible from the Makati Med Hospital through a bridgeway to Ayala North Exchange. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Wellness Center.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Okay, welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. We're here with Dr. 𝗛𝗶𝗶, an endocrinology specialist or endocrinologist who practices in Makati Med, of course. Okay, so doctor, we're talking about diabetes, type 1, type 2. You even mentioned gestational diabetes and pre-gestational diabetes, which is like really great because a lot of people forget about that. And you, as I said before the break, can I ask you to focus more on the lifestyle and the kind of food we eat? Because I think this is where a lot of people, you did say, these days we lead a more sedentary lifestyle, and it does have a lot to do with our work. And so, what other issues? If you'd like to start with, well, just go. Whatever you'd like to start with, doctor, and I'll keep like bugging you and asking questions.
So, I think what the patient wants to know is that is there really a special diabetic diet?
Yes, yes. And we often
Okay.
see ads for that, and there are cookbooks, the diabetic cookbook, right? There's stuff like
Well, if you analyze really what a diet for diabetes, it's really a healthy diet. It's a good proportion of food with
Mhm.
macronutrients. When I say macronutrients, it's your carbohydrates, proteins, and fats. And if I say good carbohydrates, good protein, and good fats,
Mhm.
so those are the things that you need to eat. You need to know what are those types of food so that we can have a very good sugar control as well as lower fat. So basically this. For sugar, let me start with carbohydrates. So carbohydrates are our fuel source. So if we take it, we are energized, right? So there are three types of carbohydrates. These are your starch,
Mhm.
these are your fiber,
Mhm.
and I forgot the other one. But these are your
We'll
fiber,
get back to it.
starch. Yeah, I'll mention it
Yeah.
later.
S-
Starchy foods like rice, potato, squash
Mhm.
can easily bring up our sugar. So you have to choose the non-starchy vegetables
Mhm.
and the good types of carbohydrates, which is your whole grains. So whole
Okay.
grains, yeah, so whole grains
So like
meaning
oatmeal, like that, bread.
yeah, the brown rice,
Mhm.
the
Yeah.
quinoa. So full of grains. So why is it good? Because whole grains has a lot of nutrients, vitamins, minerals, and fibers in that grain. So when we eat it, we don't easily get hungry. So it is digested very slow that it can make us full until lunchtime. So we don't munch on it. So those are the types of carbohydrates that we want. And also for vegetables, we need this nutrient dense, so full of nutrients, vitamins, minerals, and all of this, which can give a good self defense for our body.
Mhm.
And these are the types of vegetables like your legumes,
Mhm.
your lettuce, your carrots, your cucumber, or in our local setting, your okra, green leafy vegetables. Make
Munggo.
your plate.
Munggo
Yes,
part of the
as
already
colorful.
colorful.
Huh?
Is munggo already?
As co-
Yeah, as colorful.
protein. Yeah, a bean. Mongo beans.
So, doctor, you're saying
And
in our local setting, make it colorful, so we could like put beans, or maybe any type of beans or munggo. Then you mentioned carrots.
sayote chops, your what's this, kangkong, your kamote leaves, all of these that we see, pechay, everything. So these are easily available and not so expensive. So if you want a little more, parang you don't eat that, you're not used to that, we can do lettuce, our carrots, our cucumber, tomatoes, green peppers, all of these can give probiotics,
Mhm.
vitamins and minerals.
So
So
like
those.
green, red, orange peppers like that. The bell
Yeah.
pepper.
Yes, yes. So putting it in our plate, almost half of it or half of our plate is vegetables. That will give us a good source of fiber. It will make us full. It has a lot of nutrients, plus a little or one fourth of our plate,
Mm-hmm.
your grains, your either bread or
Mm-hmm.
your rice. And another one fourth is your protein. So good source of protein. It can be through plant-based protein, like your beans, your tofu, and legumes. Those
Mm-hmm.
are good sources of proteins and fats. Fats from fishes
Mm-hmm.
or lean meat.
Okay.
So it means that there's a well-balanced diet.
Yes. So basically, if you follow a diabetic diet and I mean, of course, check with like someone with an endocrinologist like Dr. Kapelan first. You're not yet in some stage where you really have to watch it. It's basically following a well balanced diet. What about the fruits, doctor? Because some
Yes.
people have this idea that if they eat, a lot of people like to eat a lot of fruits, and that is healthy. And people say, yes, yes, eat as much fruits as you can or as you want. But then some people say, but that's also high in sugar, or they'll think like it's too sugar. What is your stand on the fruits?
Well, we can eat fruit, any kind of fruit, but in proportion. Remember that these fruits are sweets,
Mhm.
but it also has nutrients and fiber. So there is a certain amount of fruit that we can eat per meal, like a half cup, which is approximately 15 grams of carbohydrates. So half cup of fruit can give us good vitamins and minerals, and it serves as our dessert.
Mhm.
So if you're going to see, there's no polished or refined sugar that I. So refined sugar does not give us any good benefits in terms of vitamins, minerals, fiber. There's no nutritional benefit from taking refined sugar. Refined sugar can be seen
Mhm.
mostly in our desserts,
Mhm.
sugary drinks, and all this milk teas,
Yes.
anything that is syrup, it's refined.
Mhm.
So the the fiber from it was removed, and it's very sweet. If you take it, your sugar will spike up. And if you take a lot of refined sugar, it is easily digested. So by 2 hours, you feel hungry
Need more, and
all
you're
the
happy. Yes.
so
Okay,
that's
so doc-
why that's the sugar rush. So
Mm.
when you eat it, feel
Yeah.
hungry after 2 hours.
Thank you,
I
doc. I mean, doctor,
Yeah.
sugarcane. I've munched on sugarcane itself, like right there from the field. So you were saying like, if it's refined sugar, it's something that's been processed already, and we use it to sweeten our food and all of that. But if we eat a lot of so maybe I don't know if those were the like fibers you were talking about. I guess I'm asking you to dispel a myth. If I keep munching on sugarcane, is that healthier than eating like the plain white or brown sugar that's already refined and bought in stores? We don't know.
Well, if
I don't think my teeth
I'm
can take.
sugar cane is very sweet. So maybe if you just, but it's not refined. It's really fresh from the cane. But there's an allowance for it, maybe
Yes.
50 grams. So Just
So
take care.
the next time somebody smart Alex me or it's ano naman it's right from the field. Yeah, I know we're doing this right from the field, but still it's still too sweet.
Yeah.
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 Or if we eat like let's say a whole bushel of mangoes and that's I mean there are fruits that are sweeter than others, right, doctor? Yeah.
Out of taking mangoes, pineapple. If you take it a bunch full, like one whole mango, if you have diabetes, it will really spike up your sugar. So that's why there is a recommended measurement for taking such high caloric fruit, like half a pisngi or 15 grams or specifically half cup of fruit.
Doctor, when we start measuring things, which is a good practice for many people, when you say half a cup, you mean like the cup that
Measuring cup.
the measuring cup. Okay, so not like okay, I have a cup of coffee here and that's half a cup. It's the measuring cup, right? Is your
Are different sizes for different types of cup.
yes, yes. And then
Can
also
be a big cup or anything.
when you, when you talk about grams, um you can go out and buy a scale, no, for food. Would you recommend
Yeah.
a smaller scale?
Approximate.
I
We
mean,
can approximate by using our hands. Yeah.
okay, like that when they say palm sized, unless your palm is really a giant palm, more or less, then
Yeah.
right,
Yeah.
that's about approximately a palm.
It's a half cup of this one, half cup of rice.
Okay.
Yeah.
So there's a you sort of do a fist with your but more a bit sharper with your knuckles. The second fold of your knuckles, well, yeah, of
Yeah.
your fingers. Yeah, your it's not knuckles, but your fingers. That's
Yeah.
about.
So now our Nutrition Council or DOST already released some form of guide on how we eat, like your pinggang Pinoy, or they released this approximation of carbohydrates, proteins, and fats by our hands, because we know that we cannot always bring our weighing scale to work, or we just have to approximate.
Mm.
Or we can use the plate diet, no? So half of our plate is full of vegetables and one-fourth is your carbohydrates and good proteins on the other side. Of course, for fruits, it should be half cup. That's 15 grams approximately. Well, some of the book says that if you eat apple or apple or mango or anything, the skin of, like for berries,
Mhm.
better eat the skin also, because
Okay.
it adds fiber and some nutrients.
Antioxidant thingy sounded like it with the berries. I'm not sure. Okay, doctor. Doctor, we just have to take a very short break again. And folks, stay tuned because we'll be right back and I'll ask doctor more questions, not just about the food and the diet, but also the other part that comes along with our lifestyles today, and that's the sedentary time. But sitting down here and watching us or listening to us is not bad for you. In fact, it's good for you. So don't worry if you're sitting in your car, you're at home, or doing whatever it is you're doing. This is actually a good use of your time. So stay tuned to Healthline with Makati Med. We'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Jacinto from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗛𝗶𝘁𝗵𝗹. Available for outpatient care services, our 𝗛𝗶𝘁𝗵𝗹 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, And we at Makati Med 𝗠𝗸𝗁 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗠𝗸𝗁 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗠𝗸𝗁.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. We're here with Dr. 𝗠𝗸𝗁. How are you, doctor, again? Are you getting hungry during our discussion? We've been talking about food, fruit.
Thank you. How are you, Nicole?
I'm okay. I'm starting to get hungry for
With
Yeah.
are you enjoying our discussion?
I am very much so. And we were talking about, food and the diet and how, I mean, what I picked up from what you're saying, I mean, it's just very also intuitive and simple in some ways. Eat a balanced diet, and you're talking about how to divide the plate or your portions between 1/4 for good protein, 1/4 for the what was it? I forgot the what? Sorry, doctor.
Hydrates. Your carbohydrate.
Carbohydrates. And then what was the other half again? The vegetables or the fibers, but they can make up for that. And you did say yes, eat fruit, but also keep in mind how sweet that fruit is. And if you already have a problem with having high blood sugar, then you do have to kind of watch it. Yeah. You can't say, I mean, for example, you can't say my blood sugar is high, but I'm gonna go on an all fruit diet and I'll eat like, 10 mangoes a day plus strawberries plus this.
No.
Yeah.
You know what? If your blood sugar is very high,
Mhm.
you have just to imagine syrup running into your bloodstream. So it flows very slow, and it can destroy your blood vessels, and it can, what's this? It can store fat in your blood vessels. It can cause hypertension as well. It can induce stroke also.
Yes. And
That's why, yeah, because our usual flow is like water,
Mhm.
free flowing. So if you have high sugar, the flow is like of a syrup. It's very slow.
That's why people say if you're diabetic you're at risk for stroke, and I was like, okay, why? I mean, yes, there's a reason there, I believe you, but why? And that's one of the reasons why a very very easy thing to imagine and understand is the way you put it, doctor. Just imagine your blood becoming like syrup, like a
Very slow.
yeah.
Yeah, and to transport it from one place to the other, the pressure should be very high to move it, right? For syrup.
That's pressure.
So it can burst your blood vessels, and that causes stroke.
I see. Thank you, doctor. I mean, explaining in that well and that simply is just, amazing because sometimes as non-medical professionals, we also need to hear explanations that are very intuitive for us, no? Things that we can
You
also,
can imagine.
yeah, so we can
Yes.
imagine. So thank you for that, doctor. I'm sure that that alone has already done a lot of wonders and opened up our minds to the way we think about diet and how our blood flows and how it's related, how high blood sugar is related to putting us at risk for getting a stroke. Now, doctor, just a quick question. We did mention insulin earlier. Now, if your pancreas isn't working perfectly, not perfectly, but not working well in the terms of it's not releasing enough insulin, or you're simply consuming too much sugar, your body simply consuming too much sugar for your pancreas to deal with it. As a number of people have asked, do you really have to take insulin for life once you start needing needing it, and let's say you have type 1 diabetes?
For type 1, you really have to have insulin for life because this is your saving grace for controlling your sugar, nothing else. But for type 2 diabetes, there are two scenarios. One is if your sugar is very high and you have symptoms that your health is deteriorating because of your very high sugar, the only medicine that can easily bring down your sugar is insulin.
Okay.
But it's not as if you can have it for life. It will depend on you. So we started on insulin, but of course, with diet and exercise, it can lower down. Then we can, mix it with tablets. And sooner or later, if you are going to maintain a healthy lifestyle, you can remove your insulin for type 2 diabetes.
All right.
Mhm.
Thank you for answering that question, doctor. And when let's talk about the other part of our lifestyles that we're discussing right now. It has to do with the exercise and movement, doesn't it? Can we talk a little bit more about that, doctor? So, one, we're sedentary. Go ahead.
Okay, so for diabetes, we have an ABC. So A is A1C, control of your sugar. HbA1c is the measure of your 3 months average blood sugar. So B is your blood pressure, C is your cholesterol, and with this, it entails lifestyle. Exercise is really good for us because it burns our excess calories. It can make us lose weight. It can build us muscle. So it can control our sugar. Remember, if we have pre-diabetes, a lifestyle treatment is really expressed or parang mandated to do to prevent diabetes. And when you have diabetes, aside from medication, exercise and having avoiding sedentary lifestyle, aside from taking your diet seriously, can control diabetes and its complications. So why? Because it makes our heart pump and wash off or burn off calories, so can make us look younger and build us more. Yeah.
So, doctor, we've heard some
Make
people.
our circulation better.
Yes,
Mm-mm.
yes, it's right. And doctor, like I have heard, I think in general, some people say I can't exercise that much because I have diabetes. So is that, I mean, you just this kind of dispelled that myth, or are there cases where maybe it's because of the severity? I'm not sure. Can you talk about that just a little bit?
So with physical activity, it's because parang the notion of everybody is you have to go to the gym, you have to run. And how can you run when you have, arthritis and everything? There are different exercises to different kinds of people. Like if you have elderly, 65, 70, you don't expect them to run as like a marathoner or with lifting heavy objects, but you have instill in them physical activity like walking every day or making training, no? Weightlifting or just a small weights that can give muscles, no, to prevent a worsening of your blood sugar. But physical activity entails also mobility, and also physical activity is something that you really want to do and capable to do it. So you cannot push a person to weight, lift weight or run like a marathoner if he cannot. But he has to start on something and then progress its activity.
Yes.
Okay.
That's a great point, doctor, because it also actually the whole image of going to the gym and then being, as soon as we think exercise, I think sometimes these days we think you have to suddenly look perfect. No? The body image has slowly been changing into that. You have to look perfect or have these like cut abs and be very, very lean. But I mean, I know people who go to the gym and they may be a bit on the plump side, but the thing is they're healthy and they're okay with
Yeah.
how they look. They're not
You
trying to impress
have
anyone.
to start thing. So, for example, I have patients who are in the office like 12 hours a day. You cannot expect them to go to the gym. So what you do is to walk around, walk around the room every 5 minutes, or every hour, 5 minutes, or after you eat, you just walk. There's a physical activity. And then when you are inspired by it, then you can do more. So it's like motivating your patients to increase their physical activity. You can do physical activity at home. You can do your uh, household work. You can clean your house. You can clean your car. You can do vacuum with your sala. Anything that makes us mobile. That's physical activity.
And a lot of
Up
people.
and down stairs. Up and down the stairs, up and down the stairs of your office can pump your heart and burn some calories.
Yeah.
So
I know a few people actually who get really they love cleaning. It's like their therapy. And that also gives them some exercise, right? I mean, cleaning, doing chores, and I guess yes, walking around. And I was gonna ask you, but you already mentioned it. How about persons with disabilities or older people who who have, let's say, bad knees? And as you said, just walk around, or maybe if you walk to the bathroom,
there,
walk around the
yes.
room.
Well, the era of social media, especially in YouTube, there are different chair exercises that we can download or we can watch from our social media, and they can help us. So there are different websites wherein they cater those who cannot walk well, or they are inspiring people to be mobile. Even though they cannot walk, they can have exercise, hand exercises, no, hand bicycle, or lifting your knees,
Uh,
just like that. You don't
you know,
need to pressure your knees.
when I was um when I was a lot younger, there were some of the old exercises, like they seem to make more sense as though we're going back to them. There was this thing where you would pedal your hands, no, instead of your feet, or you'd
Yeah.
yeah, yeah. So I mean, okay, so now you can actually do that. Then it seems to be going back
There are
to basics in a
chair
way.
exercises. You can mobilize your abdomen. It can give you good muscles in your biceps, triceps. So there are different exercises that can cater to all types of person.
And I love how you said, okay, we're in the digital age where you can watch on YouTube or any other app. I guess I'll just ask you kind of how to certify it in a way, because many times our work already makes us sedentary, and then sitting in, for Metro Manila, at least sitting in traffic. I mean, how can you be, after that, how can you have the energy, or even before that, if you do that, your work suffers because you're half asleep already by the time, by the time by a certain time of the day. But I'm glad you mentioned that. Okay, since we're gonna be on our apps and stuff, or on the phone, or answering messages when we're not working, or whatever it is, you can also take some time to actually use it to exercise. The chair exercises. That's a great piece of advice, doctor. I just really, I mean, that I often forget that, and thank you for reminding me and our listeners. Now, doctor, can diabetes cause blindness? Um,
Yeah.
and why so?
Well, yeah, with chronically or prolonged high sugar, it affects every blood vessels in our body from head to toe. So you can have stroke, you can have blindness, you can have heart disease, can have hypertension, and also you can have blockage in our feet. No, so
Mm,
that's where you can see those who are amputated,
yeah.
everything. and also it affects our nerves. So sometimes with very high blood sugar, it coats our or destroys our nerves, and it presents a tingling sensation or makirot. But sometimes we cannot feel anything when we walk. Sometimes they iwan yung slippers when they walk, but they don't recognize it. Sometimes they were pricked by a nail,
You didn't realize it.
nabunggo, na prick,
Yeah. And then
and they
Mm.
and it can lead to severe infection, and so goes our amputations later on.
Yes, that's why it happens, no? And then, doctor, since I'm told we need to try and sort of like, I'm having so much fun with this discussion, but I'm told we should sort of like get to our last few questions and try to wrap it up because we're out of time. We're running out of time for this show, but I mean, God, it's leaving me wanting more. As an endocrinologist, what are some of the weirdest and also like the most untrue, like the myths you've heard or wrong beliefs about diabetes?
So, well, most common that your patient says, wala na akong kakainin. So again, there goes a balanced diet. And they say that it can be treated by herbal medicines. There's no truth to that, and there are no long-term study that can prove that some herbal medicines can really, really treat diabetes. It's really lifestyle. Take it.
I've heard somebody say that too na, iinom lang ng laga lang ng laga ng ganito, tas inumin as titas mawawala niyan. And I said, baka naman din kasi nag-watch ka ng diet mo, baka may iniba kang ginawa, hindi naman siya talaga ganun kataas. Siyempre, kinukontra ko pa yung nagkwento. Pero, I mean, isn't that part of it? Sorry,
we have to be careful. We have to be careful with the things that we take, no? Especially with herbal medicines that usually online they are promoting it, that you know it, and sometimes they have no long-term studies, and we really don't know what's the effect on our body. So it can affect the medications that we take, or it can affect every organ or any organ of our body. So we really have to take care in believing all those things.
Doctor, for some things though, like if you eat ampalaya, record that can lower your blood sugar level, right? But it's not necessarily to the level that you want it to be, like
Well, if you eat ampalaya, if you eat kamote, if you eat a lot of green leafy vegetables, it can really lower your blood sugar because they have fibers, and it make you feel full, so your sugars will definitely go low. But definitely you cannot eat one type of macronutrients like protein lang ba or fat. It's really nice to have a well-balanced diet so that our body will have a complete nutrition for our defense system, for our health also, for our heart. Yan.
So it's also like, let's say fad diets and things we hear na part of it. And yes, there are supplements sold online and all of that. But there's a reason, there's a reason why, they don't really work. And how can people who hear these things and who are so convinced, how can they confirm if it's medically accurate or not?
Well, one is go to our FDA website if it's really approved, no? And of course, consult with your doctors. So your doctors know better, and they will tell you if this is harmful for you or not. So that is really the best advice.
Okay. Yes, because you might be eating all sorts of things or taking all sorts of things, and it's not, it's not.
I have a lot of patients who are telling me this medicine. Who told you? Sabi, who advised you to take these medicines? I just saw it in YouTube and they said it's effective. So I said, no, you have to consult your doctor. If you don't want to see or talk to a doctor, go to FDA website and check if this is really approved. Because we as doctors, we follow what is approved, legally approved by our FDA, and what is a medicine that has been uh, long-term evaluated, so
Yeah.
long-term study.
Yung parang long-term study na okay, this is really proven, you've done it on test groups so that you're really, really sure you don't just give any advice on some brand new thing, basically. And you've,
Before it's approved, or before it's the medicine or the concoction of medicine being given to you, it was studied 3, 4, 5 years before given. It's studied in the laboratory. Next will be the animal study. Next will be in some human data. So before it was given or be out in the market, it is well studied as proven by different journals.
okay, thank you.
Journal.
And doctor, do you have any advice or messages for people who, well, maybe they do have high blood sugar, maybe they think they do, or maybe somebody who's is telling them, I think you have this, and maybe that loved one is right. Maybe there's a loved one or friend who happens to even have diabetes and saying, maybe you have it too. And I mean, judging from how the way you eat, or like how how big you are, or whatever it is, that you might have it, or it seems that you keep eating a lot but you're tired and you're really, really thin and you seem to be losing more weight. Maybe you should have that checked. And then even from that stage to those who have been newly diagnosed with diabetes or pre-diabetes, and up to those who have diabetes and have been living with it for a while, you have any messages for them, advice?
If there are clues or tips on when to check your sugar, one is a very strong family history
Yes.
of your physical family.
Yeah.
Two, if you have sedentary lifestyle, you don't have physical activity, or if you're gaining weight, or if you have a history of gestational diabetes, or your babies are big when you delivered them, history of big babies, hypertension, and if you have gained a lot of weight and you have signs and symptoms or medications that can increase your blood sugar, like steroids and some medications for cancer and some medications for HIV. So we really have to check. So if you have this, and if you go to the website of American Diabetes Association, there is a form wherein you can check your risk factors, and if this score comes up, then you have to check. You have to be screened right away. So for those things that I said, you really have, as early as 40 or 35 years old, you have to be checked for your blood sugar. Because you can see people who have hypertension as early as 25, 35, and those who have also fatty liver. So it can also they might have diabetes also.
And how does one get fatty liver?
Fatty liver can be from the food we eat, sedentary lifestyle, and gaining weight.
Okay. And then, doctor, I forgot to ask you earlier about the family history also of diabetes. Now, is it true? Like, what are some of the things you'd like to say quickly about that? Yes, if it's in your family history, you should get screened. But some people believe, one of my parents has it, I have it already. That's not necessarily true, right?
You have the genes for having diabetes if your parents have it, but it's up to you if you allow it to go into your system and destroy your pancreas. I mean, if you abuse yourself, like not having exercise, not eating the proper food, and then you have sedentary lifestyle and not monitoring your sugar, not screening it, then you might have it, but you can prevent having it, even though you have genes for it.
And doctor, what about taking our blood sugar? Um, we can buy we can buy kits, right? Is that advisable to do it ourselves just to check? I mean, but no, right? Okay, go ahead. Sorry.
Okay, one of the reason or one of the things how we know if our sugars are good or bad is monitoring, and it can prevent us, or it's just a warning sign also if you monitor and say, oops, my sugars are very high, so we have to review what I ate, what am I eating this past few days. And then if you avoid it, you can see that the downtrend of your sugar monitoring after you avoid those things that can make your sugars high. And it's really effective. It's one of the helpers in taking care of your blood glucose, of your diabetes. So I see patients who come to my clinic every 2 to 3 weeks because their sugars are very high. So I let them monitor. And then now I can see that they're improving and they feel better.
Yeah.
And they know, and it's a teacher, so they know what to eat and what not to eat by themselves, because I cannot be watching them from time to time. They're all on their own. So better have this monitoring and learning from it.
Okay. Thank you, doctor. You know, we're out of time. Is there anyone you'd like to say hello to, or just anything else you'd like to say? I'll give you the floor for this show.
Thank you for inviting me, Nicole, for this segment and for this show. And really, we are inviting you. We have our Diabetes Awareness Week to be held last week of July at Philinvest Mall. This is in cooperation with our Philippine PCDAF, for Foundation for Diabetes, from our mentor, Dr. 𝗛𝗲𝗁𝗁. And every hospital and every society are in one in celebrating or making awareness of diabetes, because it is not an easy disease. It's really a chronic disease that can destroy lives of our loved ones. So we really have to take care of them.
Thank you,
Okay.
doctor. Thank you for being on the show. And then I would like to say hello to Tata. Tata, I love you. Mom, I love you. And the rest of my family, I don't know. No, I'm just kidding. I'm just kidding. Okay. Anyway, folks, and thank you, doctor, for being on the show. Please do come back again soon. There's so much more to discuss in terms of diabetes and other things that have to do with endocrinology. So FERCs. Okay, so FERCs, no. So folks, I'll see you next week on Healthline with Makati Med. Take care. We'll see you next week. Bye-bye.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.